Welcome to Dr. Arthur Fedororwski, Senior Consultant in the Cardiology Department at Skåne University Hospital, and also Lund University Hospital Department of Clinical Science, based in Sweden. Welcome, Dr. Fedororwski, and thank you for addressing questions posed by patients on syncope.
Oh, thank you for inviting me to this session.
Now, syncope is often said to be a symptom of an underlying condition. Sometimes it can be a potentially fatal arrhythmia. And one question we always check when we hear from our patients is that, is there a history of fainting in the family? And often we will find that a grandfather or an uncle or a cousin may have died in their 30s, and they also had a history of fainting. So is there a link between syncope and sudden death?
Yes, of course. These patients are not so many among all syncope patients, but the consequences can be fatal. And we have quite good treatment against even fatal, possibly fatal cardiac syncope. And what I mean is implantable cardioverter defibrillator, which can stop the cardiac arrhythmia, preventing sudden cardiac death. To identify these patients, as you mentioned, totally correctly, the family history may be helpful. Then the history of syncope, of fainting, may be also helpful. If it happens as without any problems, without any warning signs, if you cannot prevent the fall, if you cannot defend yourself in a proper way, usually it means that the cerebral hypoperfusion occurs very quickly, so you don't have time to protect yourself. Then you should look at your heart. We have a very nice method of echocardiography. You can see the heart structures. Unfortunately, not all cardiac arrhythmias has something to do with structural changes in the heart. So there are other electrical, idiopathic or electrical disturbance in the heart rhythm that may provoke sudden cardiac death. So we have genetic tests. We can provoke arrhythmia in the so-called electrophysiology lab. And in the end, when in doubt, no doubt, we use implantable loop recorder to catch the ECG during the episode of interest.
Thank you. And we have videos on some of these potentially fatal arrhythmias that may only display as syncope for patients to view as well. But it is important, and I think you agree with our message, that there's no such thing as a simple faint. And we should always try to identify the cause of our fainting. And it may just be a case of increasing the amount we drink, but we definitely need to rule out any underlying more serious conditions. And I think the STARS checklist that people can download help with this as well, helps you and your physician to answer questions and ensure that you're receiving the right diagnosis and treatment.